Lancaster. In our footprint, we've got one integrated care system in Lancashire and South Cumbria, a healthcare partnership covering Cheshire and Merseyside, and in that there's 23 NHS providers, 19 CCGs, 14 places, boroughs, 9 universities, and we've got a large number of life science partners. And our role is to spread innovation, connect with others and partners, including local government, industry, the NHS, and collaborate across those areas. We've got offices in Daresbury at the Science Park, Liverpool Science Park, and Preston. We're one of 15 AHSN networks, and the AHSNs cover the entire country. So that's just a map there of the different areas. They're regionally focused. So you'll see us up there on the top left, and then there's other areas such as Imperial College covering London, and and Wessex down south. So, and we do work together as a sort of connected network of networks. And as I said earlier, the AHSNs are catalysts for innovation, connecting partners across different sectors. Big thing around creating the right environment for change to happen, and collaboration. These are just some, I'll just give you some of the examples of the type of work we're doing at the moment. We're responsible for sort of spreading and adopting new innovations. So there's national programs. These are things that have been proven in areas of the country to be really evidence-based, but they've struggled to get the adoption across the rest of the country. So there's areas there such as atrial fibrillation to reduce strokes, PINSA for prescribing errors, and the PRECEPT program, which is around using magnesium sulfate to prevent cerebral palsy in preterm labour for maternity units. So this is just an example around the escape pain piece of work, and what you'll see there is early, the program came into being around about September 2018. Prior to that, a small number of sites, roughly 50, were using the escape pain program. And as a result of the AHSNs really focusing on that, we've now extended that to 194 sites. And you can see the numbers of people there who are now, people with osteoarthritis who are now benefiting from the escape pain program. Sorry about that, going right to the end. This is the PINSA program in GP practices, and again you'll see round about the end of 2018 when that program was starting to be a national adoption, you see the massive increase there in the number of practices. So this adoption of innovation doesn't happen on its own. There's got to be programs of work that are supporting it. This is another area called HeartFlow. We're also responsible for rolling out new technologies. So this is a software package which evaluates functional significance of lesions. What it aims to do is reduce the number of patients who need to go forward for invasive angiography. It's cheaper than invasive angiography, and it's much quicker, 5 hours compared to 6 weeks. But the funding issues meant that it's been quite slow to pick up. So a lot of the work of the AHSNs working with NHS trusts to really start to get the adoption and see some of the benefits from that. So in terms of the AHSN network, this is just some of the impacts that it's had. You can see over 22 million patients have benefited from the programs. A big part of the AHSN's work is bringing new money in, could be from Europe, could be from industry grants, could just be new venture funds. But a key part about creating new jobs, creating wealth, and bringing more commercial elements into the NHS. And you see there that over 330 innovations now have been introduced through to the AHSN influence. This is just some of the other examples around some of the preventative work that we've been really pushing out across the AHSNs. And I won't go through every single one, but you'll see that there's a little device called Detect Atrial Fibrillation in 60 seconds. And that's used by areas such as Cheshire, Fire and Rescue, and intermediate care. So it's demedicalising a lot of the work that can be done. You'll see a lot of the wearable tech and smartphone technologies that can help people take more control over their own care. So a lot of this is about working with with industry to help them understand and navigate NHS systems. It's extremely difficult at times to navigate your way around the NHS. Very complex system. The procurement rules can be really tight, and it doesn't help the innovation. So some of the types of things, and you'll see a little bottom of the picture there, it's about introducing the clinician to the industry and really starting to get that engagement that can create that collaboration and get some really smart stuff going at times as well. A lot of the work at the AHSNs is what we've seen a big move over the last couple of years is what we would term clinical entrepreneurs. So there's a lot of clinicians out there who've got that entrepreneurial spirit, who are coming up with solutions that are transforming the way that we work. About 15 innovators are selected every year, and they become fellows, really pushing some of their innovation products. And I'll give you an example of one, which is, it's called DocAbode, created in the northeast of the country. And what that does is it's like a workflow scheduling document, which allows clinicians to pick up cases of out-of-hospital care, out-of-hours care. Whereas at the moment, we employ doctors sitting in cars a lot of the time and shooting around to people's homes. Rather like a Uber taxi, the clinician can then start to select which patient they're close to, where it might be they're living close to, and that they can get to their home within a particular space of time. This is Ian Hennessy. He's a consultant paediatrician from Alder Hey Hospital. He's also the Director of Clinical Innovation at Alder Hey. And back in 2014, working together with the Innovation Agency, we created the Alder Hey Innovation Hub. And it's the first ever collaborative trust hub where industry, small enterprises can come together with clinicians in the Innovation Hub. The Innovation Hub is actually in the basement of the hospital, a brand new hospital that was opened at Alder Hey, and it's known as the Bat Cave locally. And what we get into there is people coming together with clinicians, starting to come up with what are the problems that are facing them every day, and starting to look at where technology can help address some of these issues. They've done some really smart stuff with 3D kits in that area, and this was the first ever collaborative NHS Trust Hub. Ian's brought a big change to the way that the Merseyside health system engages with local industry as well. I'm just going to sort of give you one big example around the changes, which is around telehealth. So telehealth's a clinically led service, and it's where basically the clinical services it's within Liverpool, but it's extended out now. But they deliver that in a different way, where the technology is used to put the patient virtually in front of the clinician for triage, treatment, or therapists for support. It's been in place across Liverpool since 2012, and it is the biggest deployment of telehealth anywhere in Europe. And it really helps to empower patients to actively manage their long-term conditions themselves. Also, tele-monitoring service that's monitored 24/7 by clinicians within the community trust. And what it's really trying to do is support behaviour change through supported care, enables patients to live at home, look after their own health, and reduce the chances of hospital admission. So telehealth can really help across that whole care continuum. So you see there from primary prevention through to long-term support and recovery. But we're also seeing some other benefits from this work now. We can start to integrate mental health tools with the physical health. Merseycare are a combined community and mental health trust, so they've really taken that to another level now in terms of its mental health development, but also supports the specialists coming working more in the community settings. To date, over 12,000 patients have actually been supported via telehealth. And recently, because you'll see there's some data around the pre-COVID and how that's operating. Pre-COVID, caseload of around 1,700 patients at any one time. That's now extended to about 6,000 patients at any one time are on the caseload for telehealth. They've extended the server capacity up to 16,000 and extended the number of pathways that are supported around telehealth. It's really changing the way that the care is delivered. So now a nurse to patient ratio is 1 to 500. So one nurse can look after 500 patients via telemonitoring. And on any given day, there's about 5,000 patients who are monitored. Key benefits around telehealth, but what we're seeing is a significant shift now in community nursing capacity. There's been a lot of lessons learned in the pilots that they did within Liverpool. Is at one stage, it was more junior clinical staff who were manning the telemonitoring services. Now it's some of the most senior staff, because what they found is you get your most experienced staff at the front door. And in this case, that's the most experienced staff on the viewing the monitoring signs and contacting the patients. So you can manage thousands of patients, no limits to geography. Infection, obviously, because of COVID, infection control down and PPE being managed much more better. Key part about the next slide, over to the right, really, around the cost contrast. What you'll see there is, on the traditional nursing model, to manage 1,000 patients, you'd need about 80 full-time equivalent staff. On telehealth, you're now down to about just under 11 full-time equivalent staff. The cost difference is a significant cost per patient. Okay, and then cost per patient for the traditional nursing, 2,500. This is just some of the outcomes. And you'll see a big area there, very popular with patients, and a 22% reduction in emergency admissions for telehealth patients. And then just finally, my last slide is what we're now seeing is the concept of the Digitician really is. What we're trying to demonstrate there is we're starting to, over the last couple of years, we've seen that breakdown of traditional professional groups. We're bringing that digital expertise now into the multidisciplinary team, and increasingly that's clinicians who've got that digital expertise. But the clinicians are asking questions of the technology, and then that's changing now the model of care. There's always been the cutting edge of innovation in the health services, but the way that care is delivered and the model of care has really lagged behind. We're now starting to see big changes. Thank you very much.